Assalamu alaikum. The communication day. Mr. Golowi, 68 years. You are the doctor in the neurology department. His known case of progressive supranuclear palsy. Suffered recurrent episode of chest infection. Neurological examination, positive for finding suggestive of pseudobulbar palsy. Referred for video fluoroscopy. The speech and language pathologist commented that there is abnormal swallow reflex and limited tongue movement. Your consultant think that the patient is at risk of developing serious aspiration. For that, he suggested other options of nutritional support, including the Ryle tube and the percutaneous endoscopy gastrostomy tube. The task is to speak to Mr. Galloway, update him about the result of video fluoroscopy, and try to negotiate a plan regarding his feeding. Okay, we'll start in a moment. Okay, ready?
Okay, Dr. X.
Hello, I'm Dr. Mukhtar, the doctor in the department, nerve department. You must be Mr. Galloway.
Yes, doctor.
You are 68 years.
Yes.
Can I call you Mr. Gol?
Yes, sure.
Okay, Mr. Gol, can you? We are here to discuss about your health issue. That okay for you?
Yes, please, doctor.
Okay. Before starting, can you tell me what do you know so far about your condition?
So, doctor, I have been getting these recurrent bad chest infections. So, my doctor has referred me to do this imaging study, and I'm here to see what's the results, doctor.
Yeah, I appreciate your knowledge about your condition. Can you tell me what's your expectation?
So, I'm not sure. He told me that he has suspected some problem with my swallowing, I think. I hope the results are good, doctor.
Yes, I appreciate your worry and your concern, Mr. Gol. The result actually with me now, and I will tell you the result. I'm afraid to say that the result of your tests is not good as we hope.
What do you mean, doctor?
Yes, I appreciate your worry, Mr. Gol. Let me tell you the result for your swallowing and the tongue movement, assessed already by our expert team, showed that you have less movement in your tongue and the swallowing as well. I'm so sorry to tell you that.
I'm sorry, doctor. You mean what, sorry, exactly?
I mean, the swallowing from now onward, it will be difficult to be usually happen or as usual and as any usual person or as normal person.
So I have a problem with that. So I'm not sure.
Yes.
Can you help me regarding this?
Yes, we are here to talk about the options and the solutions for your problem.
Is it curable, doctor? Can you give me some medicine to cure it?
Unfortunately, Mr. Gol, it's not curable one since you have some disease affecting your brain and also affecting the center of swallowing from your brain.
This is bad, doctor.
Yeah,
So
I'm sorry about that.
What will happen next, doctor?
Yeah, let me also explain to you about the disease. It's a progressive one, and it might affect also in the future some of your awareness, and it also might lead to some shaking in the hand, along with the vision upward and downward. Are you following me?
Yes, doctor. Yes, I am.
Okay, for that, our team decided to put for you two options or two solutions for the feeding. Are you ready to hear about them?
Yes, doctor. I hope, yeah, I hope if this will be helpful for me, if I will be
Yeah,
well, yes.
actually, it's not as the usual and the normal one, but it replaces the normal the normal function. I mean, in any normal person. For you, we can insert a tube through the nose. This is one option or the first option. The second option will be through a hole in your tummy wall, and also it will be tube inserted through that. Do you follow me?
You mean you will make a hole in my tummy, doctor, for the food?
Yeah, this is the second option, Mr. Gol.
Uh, I'm really not sure, doctor. It is, I'm not sure really. This is big news for me, you know. These two
Yes,
are the only options available. There is no medicine, something that will help me. Just
I
because.
appreciate your concern, Mr. Gol. I'm afraid to say no option and no medicine for your condition right now. And this feeding option, just to replace the way you are not able to take through your mouth. You might have infection as you had before.
Oh, yeah. Okay. So can you tell me more about them?
Yes, I'm here to address all your concern. So starting by the one through your nose, it seems that it's for the short time. And the good thing is you are not feeling and you will not be when going to the operation room or the endoscopy unit or the camera scan unit. It can be done in the bed while you are lying in the bed. This is the first option. However, it might be changed every 1 month in order to prevent infection in your nose. How do you feel about this one?
It seems painful, doctor, right? This really seems because I'm
Uh,
not sure if you will do that. Is it painful?
I appreciate your concern. Yes, it's not painful as you guess, Mr. Cole. We can put some gel through the nose, and this gel might numb the nose and the area where the tube will pass through.
Okay. I'm not sure really because you know I'm working actually. I am a manager in a big company, so this will be very bad. You know, really having this tube, it will be apparent, right? Everybody will be able to see it.
Yeah. Yes, you're right, Mr. Gol. So the second option might fit with you. Are you interested to hear about?
Yes, please, doctor.
Yeah, so the other one is called big tube percutaneous gastrostomy tube. This one will be done by camera scan in the camera scan unit. You will be admitted for 1 day, and we will be giving you some pain management medicine, numbing medicine to the area. I will draw for you how it can be happen. Actually, by inserting a camera scan through your mouth after, be sure that you are not feeling that. Then through while we see the light coming from the tummy wall from inside here, we can make a small cut in your tummy wall, and guided by this light, we will put the gastric tube or the tube which I mentioned already, and it will be fixed under the skin, and you can see the area and the part from the tube outside the skin, which you can be handle this tube by yourself. You can give the food by yourself through this tube. How do you feel about this?
It seems like it's a surgery, doctor. This will be like surgery or
Yeah, I appreciate your concern, Mr. Gore. We call it mini surgery. It's not major surgery. It's just small cut, and it will be happen within minutes. And hopefully you can be discharged and going home the same day if everything went smooth. How this sound for you?
um. I think this is the best option for me now.
Yes,
Uh,
the good thing also in this tube,
two
sorry
minutes.
to interrupt you. Yeah, the good thing that It might be covered by your clothes. No one will notice about it at all. And it can live longer than the one through your nose. How do you feel about this one now?
Okay, doctor. I think I will go for the option of this tube in the tummy, yes.
Okay, Mr. Cole, I will give you the paper called consent. Read it carefully and read the instruction, the steps, and the preparation. And at the end, you can sign for the approval.
Okay. Okay.
Okay, can I ask you some question?
مرة في العربية بتاعت مريم ويحيى فين؟
Sorry. You are working as counter, right? Manager?
Oh, doctor, I'm a manager. I'm a manager in a big company. So
Okay. Do you need any other help related to your health? You
no,
can cope with your job.
no, now I'm managing it, doctor. Thank you so much.
Do you drive?
Yes, doctor.
Yeah, because this disease might affect your vision, I can advise you to have a driver or to stop driving from now onward. That okay for you?
Yes, it's okay, doctor.
Okay, you need any other concern?
No, thank you, doctor.
Okay, time is up.
Time's up.
Yes, you can comment now.
Yes, so this is about the procedure. These two procedures together. The Ryle tube, which is the nasogastric tube, and the big tube. So this is about, he knows, I think he knows already. Yeah, it's supposed to be, if we have checked more about the background, he has more, he knows around the disease, he knows everything about it, but he does not know still about the results of the video fluoroscopy. Video fluoroscopy is barium swallow. That will show how they will give him something to drink, and then this is the barium, and then they will see where the barium will go. And in his condition, the barium went to the air pipes. So now the only option for him is the nasogastric tube or the big tube, because he has the problem about the cosmetic features of the nasogastric tube. He's refusing it, so the best option for him will be the big tube. Explanation about the procedure, as you did, doctor. Yes, you will give him first. That's how you will prepare him before. Especially for the big tube, you can tell him if he's ongoing on blood thinning medication, maybe you will stop it a little bit before proceeding for this procedure. Then you can tell him what will be done in the procedure day, that we will send him to the endoscopy unit, or you can tell him the camera test unit, so that they will insert, or they will put the camera inside him. Then they will see, they will make a hole, and then they will insert the hole in his stomach for the feeding. And then after the procedure, maybe he will be for follow up a little bit. They will do some more imaging studies to make everything sure. This is for both, for the big tube and then the tube. And then after everything is okay, he will go home and he can use it at home. And they will give him a referral for the nutritionist also to instruct him how to use it, as the food has to have specific consistency, and they will give him an instruction how to use it. That's it. You can offer help also about the driving. Yes, this is good. This is good offer also. And also the help, you can give him more sites and brochures about the disease and about the aspiration, so that he can understand what's happening with him. That's it. Yes, you did excellent, Dr. Bassam, as usual. Thank you.
Okay, thank you, Dr. Sarah. Dr. Aisha asked about the disease name. It's progressive supranuclear palsy. Okay, another question or any comment before going to the next scenario?
Actually, here I went and I told you why I'm refusing the nasogastric.
Yeah.
Actually, in the
Suppose I am the one asking, right?
But actually, I did not. I was not supposed to give you why I'm refusing the gastric tube. So you're supposed to ask why.
Yes, yes.
Because but this one I gave it to you.
Mhm.
I gave the answer already, but you should ask also. You should explore why he is refusing the first option.
Yes, exactly. And also in the occupational issue, I will ask the job. It might be. Or while saying the advantage, disadvantage, also I can say it will be like that.
Yes, that's right.
The most important here, just not to forget the offer for help. Yeah,
Yes, really
any
important
help
to help.
regarding, yes, because he's going to the job still, and he might need some occupational
Yes, that's
support. Okay, complication of aspiration, need to speak more details. I don't know. I didn't feel that he need to explain about that. I think he knows. I guess that I don't know if he knows or no. But you're right. If the serious need,
Actually,
if he refuse, I have to convince through that. I think so.
if he
But
resists more, if
yeah,
يعني he will part
yeah.
of the
If he said yes, I will. If he said I will, no, I don't want any option. I want to use myself or
yes.
my mouth to take by air by mouth. I mean, I think we have to convince him by the seriousness of his condition and the recurrent aspiration. What's your opinion, Dr. Sir, right?
You can mention it, but it will be more important if the patient is resisting the intervention.
Yes.
Because maybe sometimes he will resist this intervention because it's intervention, and he's expecting to have any medication or anything. So yes, I think better to say about it, but more important, you have to mention the aspiration complication if the patient is really resisting the intervention.
Yes,
It's,
I agree. Okay, I like this scenario. I don't know if you attend this scenario yesterday with Dr. Ahmad.
no.
Okay.
Actually, this was no, I attended with another mentor, but it was 1 year ago. 1 year
No,
ago.
no. I mean the scenario I post to you.
No, sorry.
It's okay.
I misunderstood.
So I attend this scenario yesterday and I like it. It might come and because I don't know Dr. Ahmad, I think he's examiner and maybe he's posting new scenarios. Okay, this is your scenario. You can see in the chat. Mrs. Noha, 91 years. The relative Mrs. Hanna, the patient daughter. Patient admitted 6 days ago following left-sided chest pain of sudden onset. Diagnosis of acute MI followed by angioplasty and stent was placed. Suddenly, she developed acute pulmonary edema, acute renal failure. Her echo showed severe left ventricular dysfunction. The GFR down to 15. The normal is 90, sorry. The medication were optimized without any improvement. She became more hypotensive, 60/20, and oliguric. The medical teams had decided no further cardiac or renal intervention where possible. She seems to be dying. Your task, explain the patient daughter that her mother seems to be dying and no benefit from resuscitation. Take 2 minutes, then we'll start, okay?
Okay, thank you. Oh, okay, we're trying.
Okay, start. There you go.
Okay. Hello, my name is Dr. Abdullah. I am one of the medical doctors in the clinic today. Can I confirm that you are Mrs. Hana, the daughter of Mrs. Noha?
Yes, I am, doctor.
Yes. So I am here today to explain more about your mother's condition. So can you tell me more about what you know about her condition?
Yeah, my mom was fine, doctor, and she just had some chest pain when we brought her to by the ambulance to your hospital, and they said they will do some lab test and some image. That's it, doctor. And after that, they told us it has heart attack. And they did, I think, the possible management plan, and they said everything were okay.
Yes. So yes. What are you expecting her condition will be, or what's your
Yeah, I expect everything went fine. So today she might be more better, and I can take her home.
Okay, and you have any concerns, any other concerns about her condition?
No, doctor, that's it. I hope she's fine now, doctor.
Okay, so as you know already, yeah, she had this heart attack, and unfortunately, we did everything we can. We have referred her to our team, which is, by the way, one of the best teams that can manage such cases, and they did some imaging study for her vessels that supplying the heart, blood vessels or blood channels, and we found that she has a problem with the blood supply. So they did this intervention, the camera test, or the intervention camera test, and they put stent inside. But unfortunately, the heart, we call it the left side of the heart, which is the one responsible for like pumping the blood all over the body, unfortunately was damaged severely. I'm really sorry for that.
What you mean, doctor? So
So
why you took her to the
yes,
surgery or procedure?
yes, we sent her to the procedure because this is actually the best option and the best treatment for such condition. This is the intervention that proved by many doctors and many researchers that it has the best outcome in such patients like the one that your mother was having. So really doing this procedure was life-saving, but unfortunately the outcome was not as we hoped. I'm really sorry for that, Mr.
So
Han.
you mean, doctor, it wasn't the best interest for her?
No,
Do you think it's error, doctor? Any mistake happened there?
no, I assure you that, as I told you, our team is the one of the best teams and they have much experience in such conditions. And really, doing this procedure or this intervention was really important for your mother, and she really needed it. But unfortunately, the heart did not survive such. There was cut in the blood supply to your heart, so the heart did not really survive this shortage in blood supply to it. So she developed something we call left ventricular dysfunction. Don't mind the medical name, but means that the heart, the part of the heart that's responsible for pumping the blood to the body has been severely affected. I'm really sorry for that.
What now, doctor? Tell me, what about her condition now?
Yes, actually, this part of the heart that's responsible for the pumping blood has really caused her to accumulate fluid inside of her chest, and also has led to the kidneys being affected. So really, and also this part of the heart is really responsible for maintaining the blood pressure of your mother. So unfortunately, because of this severe damage to this part, this have led to her having, unfortunately, kidney damage, and also her blood pressure is low now, and also there is a lot of fluid inside of her chest. I'm really sorry for that, Mrs. Hannah.
Oh my God, doctor. Any
So-
chance, doctor, to for my mother to be cured, to be fine?
Yes, I'm really sorry, Mrs. Hannah, but as I told you, a lot of our we have formed what we call a multidisciplinary team, or this is like a team of doctors really experienced, and when they assess your mother, they have decided that she has really an advanced condition. I'm really sorry for that.
Oh my God, doctor, I can't believe.
I'm really sorry for that, Mrs. Hannah. So just be assured that we are giving her the maximum support she needs. We are going to make her pain-free. We are going to help her go to the toilet, and we're going to help her regarding the care in the bed. Also, we can we are going to give her maximum medical support to keep her as comfortable as possible. And also, we are going, if you need any help, you or your family, like psychological support or any social support, we are ready to help.
Will she die, doctor?
Unfortunately, she has now very advanced condition. So we are really she does not have much time. She does not have much time. I'm really sorry to say that. We cannot say, of course, because this is different from one patient to another. But right now, I can tell you that she has really an advanced condition with really low blood pressure and, as I told you, severe kidney damage.
Oh my God.
I'm really sorry. Do you need help, Mrs. Hannah?
Yes, doctor. My brother is far away, and he wants to come. If my mother will die, please, doctor.
Yes, please. Yes, I would add. It's a better option, or it's a very good thing that you can ask your brothers or your sisters, any close family members, to be with you at these times. Also, if they would like to meet your mother, and it will be also supportive for her to have the close family members with her.
Okay, doctor. Thank you.
Thank you so much. So I'm really sorry, but we have also, you have heard about the resuscitation of the heart, what we call cardiopulmonary resuscitation. Don't mind the medical name. Have you heard about it before?
No, never, doctor.
So actually, when any human when his heart stops, we do what we call resuscitation or cardiac massage. This cardiac massage really has its benefit, but on the other side, it has a lot of side effects. Like it can break the bone and the muscle. It can be painful, and the patient or the human or the whoever who has this heart stop has to have already a good condition to have a good outcome from such cardiac massage. But unfortunately, because your mother condition is very advanced, our team has decided and our consultant has decided that doing such a procedure for your mother will be harmful for her. It will cause only the side effects like the breakage of the muscle, the breakage of the bone and the muscle pain, and she will be uncomfortable. And even if she survive it, she will be really in a very bad condition. So
Yeah, what you want to say, doc? You will not do heart massage for my mom?
Yes, as I told you, because of the side effects of this procedure, we have decided not to proceed with this condition if in any time the heart stopped or the heart stopped pumping.
Okay, doc.
Okay. Any other help? Any other concerns you have, Mrs. Hannah?
No, doctor. Thank you.
Okay. Just be sure that we will give you the hospital number, and also we'll be here for you to offer any social support for you or psychological support. And if you need anything, we are here to help.
Thank you.
Thank you so much. Also, we will offer you more like websites or more brochures to understand more about your mother's condition and what happened with her. And
Okay.
okay,
Thank you. Time's up.
I was trying. Okay.
Okay,
I'm not
you
sure.
did well. No, you did well regarding DNR. Don't worry. But what you miss? Patient is dying. Do you think you miss something?
Mm,
Any advance directive?
yes, I was going. I actually
Yeah.
I wrote it. But I forgot to ask about.
No problem.
I wrote.
Yes, you should do it
Okay.
because yeah, it's a matter of hours. So better to discuss it. She might say yes, she doesn't want to be resuscitated, and this will ease the decision. This is the first issue.
I wrote it in the preparation, but I
Yeah,
forgot.
no problem. We are learning now. Okay, the second thing, yeah, some jargons. And let's start from the introduction. You didn't ask the mother about the age. You asked by the name only, but you didn't mention how old is she, or even you didn't ask how old is she to confirm. So you have to confirm by two data, the name and the age. And if you have name, full name, you can take for the first and the second name. Okay. So you have to confirm the patient data by name and age, and the name to be, if they wrote two name, so confirmed by the two name, the father and the patient name, for example. Okay. This is for the confirmation of the data. The second thing, the jargon, you mentioned blood vessels, although you explained, but better from the start, you can say the blood channel supplying the heart.
Okay.
Okay, this is one of the jargon. You mentioned another jargon. I forget it now, but yet try to control. Yeah, the cardiac massage.
And stent also.
Stent. I don't know how to explain stent and
We
why.
see the metal.
What?
The name?
Metal.
Metal.
Okay.
Okay. And the cardiac massage. It's heart massage, not cardiac massage. Okay. Yeah,
Okay.
and metal, as Dr. Hunaida said, you can mention metal instead of stent. Okay, this is the second. And the other point, yeah, DNR is okay to mention, but the patient will die within hours. So you can also mention the end of life care, because this is the time of end of life care. She has only minutes or up to hours in her life. So we will not harm her by giving any, even medication, will not give her any medication. We just want her to be calm and no pain. You said pain-free, yes. But also, if there is machine, we will stop the machines. So end of life care means only painkillers and maybe IV fluid and oxygen.
Because I saw in the last line, it's written no benefit from resuscitation. So I thought they
Yes,
needed.
you did great when you explained about DNR.
Okay.
But end of life care means even nothing will be given, even the medication will not be given.
Okay, I understand now.
Yeah, so DNR plus end of life care in the form of no medication, no support, only sorry, not don't say no support, only support for the oxygen and IV fluid, but no machines. If there is machine, we will not support by machine. We will withdraw the machine. Just will give her oxygen. This is also the second point for end of life care, or the third point. Apart from this, you did great. Plus also the point of advanced directive and living wish. She might express. And when I ask you, is it error? Yes, it's. You can say no. This is not error. It's the best interest for her. However, this one of the complication, even after doing the best, because of the clot or the heart attack, the heart damaged even after the procedure itself. still it might happen. Okay.
Okay.
Yeah, this is the points here. Anyone want to add any points?
Yes, Dr. Basim, well done, actually, Doctora.
Sure, Dr. Nada, what?
Yeah, but I need her to be simple in the explanation. No need to say every word written in the scenario. No need to mention LV failure and hypertension, blood supply, everything, right? Only her heart had been damaged from her heart attack like this. Only simple word,
Yes, I
right?
agree.
What do you
Yes.
think? Yeah.
Yes. Just failure to pump the blood outside the heart.
Yes, her heart had been damaged from her heart attack, can lead to pump failure and kidney failure. That is enough. No need to say, because you consume a lot of time in explaining the complication of heart attack and LV
Yes.
failure, hypertension like this.
Yes,
So you
agreed.
waste your time. Yeah, but overall you did well.
Yeah, and also the support. Don't forget the support. You need any support at home, any
Yes.
family member dependent on your mother. And also the point of calling your brother, yes, better to support you and to be beside you and your family.
Okay. I said it in the beginning because I know that I did not have time. I said if you need any social, psychological, but I have to mention it again in the end. I think it's better.
Yeah.
Wallahi, you are right, Dr. Sarah. You know the previous scenario? I guessed it might be related to the competency and capacity because the patient has a dementia and he might lose the capacity soon. At the beginning, I was remembering to ask about the capacity, like asking do you know where are you now and the time, and anything to ask him to be sure that he has the capacity. When I went through the scenario, I forget everything. Means even if you are planning to ask this question at the end and you didn't write them in your letter, you might forget them at all.
Yes.
So whenever you remember something, ask it, even at the beginning or at the middle or at the end, because you don't know what will happen with the time, and you might forget also this point. I guess in your scenario, the capacity is important, right? Because he has dementia, Parkinson, and
the first one, but he is yes, but he understands what you're telling him.
yeah, I know, but
He's really
yeah,
I think this is one of the measurement of the capacity. Yani. I mean,
yes,
he is really interacting with you. He understands everything.
yes, I have to do that, and I have to confirm he's understanding every now and then. And also before the end, I will ask him what do you get from this meeting?
Yes, that's true.
Yeah, this is how to assess the capacity. For any dementia patient, we have to do that.
But why this patient has dementia? It's pseudobulbar palsy, not dementia.
Pseudopalpal, no, the disease itself, supranuclear palsy, yes. So it's one Parkinson plus, right?
Yes, but
Supranuclear or pseudobulbar?
both. He has progressive supranuclear palsy with pseudopalpar palsy. He has complication of
has dementia. So
I think
supranuclear.
it's not in the beginning, right? They will have some time developing dementia.
He might have
Supranuclear
it.
palsy with also progressive
but not in the beginning. I think they have still.
Yes, but still it's called Parkinson plus. So I think he will have the Parkinson component or manifestation.
Yes, I think I'm not sure here. But when I did it with the mentor, he did not mention about the advanced directive, but I don't think this was the also. I'm not
Yes,
sure.
I think, but not in this meeting.
I think it's not. Yes.
Yeah, if he has any dementia or right now, I mean, you might raise it, but if no need, because you just took the consent for the NGT.
Yes, because already you are giving him really big news, so I think him also about the advanced directive.
I think we can check the understanding at the end to be sure that we are safe from this point.
Yes, you're right. Even the point you wrote, Dr. Aisha, it's important to offer him someone to drive him home. Yes, good point to mention for the welfare. But don't forget also the driving itself. Okay,
Yes, yeah.
important. Okay. Dr. Sarah,
Yes.
I saw scenario here also shared in another group. We can do it if you are free. What do you think?
Okay. Actually, I feel like I forgot everything before the exam. I don't know.
Yeah, the feeling will start now till the exam. Don't worry. This feeling,
I'm worried. Okay.
yeah, this feeling of forgetting everything will start from now.
I hope it will go away.
It will go away after the exam only.
Well, yes. أفضل كده بس.
This is usual, yeah.
Okay.
Okay, this scenario, I just took from another group. Mr. Jamal, 65 years old, sought medical care today morning after complaining of chest pain. Again, chest pain, ECG and cardiac enzymes done and revealed anterolateral ST segment elevation. PCI done for him, the best interest of his condition after discussion of risk versus benefit, and he signed a consent. Unfortunately, his condition was deteriorated after PCI and was transferred to the ICU and had cardiac arrest. Resuscitation done for him, but unfortunately, he passed away. You are the senior house officer of cardiology department on call today. You have been asked to discuss this issue with Mr. Rami, his son who just came asking for his father condition. Okay, I will give you 2 minutes, then we'll start.
Okay.
I can speak with one scenario. One talked about his exam today to me. So tell Dr. Sarah prepare.
Sure, Dr. Aisha, please.
This now they try to mislead you by the paper written on examination stage. So just take the complaint from the paper and also make your routine examination. Just you recap it after full examination. Don't think a lot about the complaint they write because they repeat this in the last slides. Like they make complaint different that you will expect something else and you will guide your examination with something else.
Okay, can you
The case
explain?
was,
Yeah, the
yes,
example,
the case
please.
was the paper written that this patient complained of difficulty combing hair examine. This is neurological examination, okay?
Mhm.
When you examine the
This is
upper,
short station?
yes.
Mm.
They examine the upper limb. You will suspect this is myositis or something, proximal myopathy.
Yes,
Yeah.
exactly.
When you examine, first you will see like rigidity in the hand, but no tremor obvious. But there is some rigidity,
Mhm.
but like because your brain will preoccupied that you may be not
Yeah.
doing good or something like that. And they ask the patient to walk, they refuse. The examiner refused. He said no, gate. He will not examine the lower limb or change the gate, just
Mhm.
the upper limb, and if he need any other thing. The patient was weak, slightly in abduction, not adduction, and the reflexes was elected normal, but no tremors. There is some weakness, yes. Some after the exam realize that is maybe Parkinson. because the rigidity, and some also just mention proximal myopathy and due to what we know about proximal myopathy and due to cortisone, due to
Mhm.
any like just to be like
Mhm.
the advice here, just do the examination and elect the positive finding and try to recap after positive. Don't bother you about the complaint. Don't think a lot about the complaint.
Yeah, but written there, examine the upper limb, right?
Not the upper. They said like examine.
Mhm.
Just this examine.
Mhm.
But when you ask the patient to walk, the examiner said no need.
Yeah, because you will catch the case from the
They'll
walk.
catch. Yes, no problem. I don't know why they're doing it like that.
What about
Um,
expressionless face and yeah, can do
uh,
examination of the face?
yes, they didn't refuse only the gate with lower limb.
This is which center? Okay.
UK
UK, yes, all this happened in UK. The drama in UK always.
drama, yes. والله فعلا.
حضرتك امتحنت في اليوكي النهارده يعني كان طلع السيناريو ده ولا؟
2 days ago, 3 days.
دي كوميونيكيشن ولا نيورو؟
Neuro examination.
نيورو.
But see the word difficulty combing here. They didn't said any complaint. And they bring the examination for chest with the patient dressed, no bed, and with no bed.
How? How you examine on the
But
ground?
consultation, consultation, but has chest pain and the patient dressed. Wearing his clothes and sitting with chair. Consultation, no bed.
So I will examine
Very,
while sitting.
yes, and very hard while sitting.
Mm.
This is UK also, right? Or-
Yes, okay.
Okay.
Okay, start.
الله يكرمك. Thank you, Dr. Aish. Ready, Dr. Sarah? Start.
okay. Right.
Start.
Hello, my name is Dr. Abdullah. I'm one of the doctors at the clinic today. Can I confirm you're Mr. Rami?
Yes, I am.
Are you the son of Mr. Jamal?
Yeah, doctor.
Yes. So can you tell me more about what you know about your father?
My father came to you yesterday, doctor, with a heart attack. His friends told me about that in the work. And I don't know what happened, doctor. How is he now? Is he fine, doctor?
So, yeah, I'm really sorry. I'm really sorry to say that, Mr. Rami, but unfortunately, your father's condition has deteriorated after he came back to us yesterday. Unfortunately, that the outcome was not as we hoped. Sorry, I'm sorry to tell you that, but your father's condition really deteriorated after this severe heart attack. It was really severe and bad heart attack that has led severe damage to his heart, and then his heart stopped. Unfortunately, it has stopped working, and I'm really sorry that your father passed away.
What are you saying, doctor? You are talking about my father? I don't understand anything. What do you mean, doctor? What happened? Are you sure, doctor?
I'm really sorry, Mr. Rami. I know it's such a shock for you. And do you need any help, Mr. Rami? Would you like us to continue, or would you
I
like?
want to know what happened, doctor, exactly.
Yes.
Why he died? You just told me he died. I didn't understand what happened there.
Okay. So as I told you, as your friend told you, Mr. Rami, actually your father came with something called heart attack. He had some problem with his blood channels that supplies the heart. we had a specific management we do for all patients that have such condition that we will do for him. Some intervention that's very important for all patients with acute heart attack. This is like a camera test, but it will be inserted to his blood channels inside of this heart to check which one of these channels are affected, and then we will insert some like metal part to open this blood channel and help the blood supply to the heart to be resumed or to be back to normal. But unfortunately, the heart was severely damaged already. So even after doing this intervention and after following him up in the intensive care unit, he really did not. His condition deteriorated, unfortunately, and his heart stopped. And even after doing all the efforts for him, unfortunately, he passed away. I'm really sorry, Mr. Rami.
Oh my God, doctor. Oh my God. It's so hard, doctor. Oh, I can't imagine, doctor, what happened to him.
Yes, I'm really sorry. Can you tell me what are your concerns? What do you need? If you need any help?
Yeah, doctor. What you will do now with my father body? I want to take him back, doctor. Hello?
Oh, yes. Um, so after your father passed away, we will first have to our known protocol for such condition. That we will refer him first to the coroner office, so that they can examine him more and do more investigation to his condition, and then they can release the death certificate for him, so that you can proceed with the burial and the burial and any other procedures or ceremonies you need for after his death. But first of all, we have to refer him to the coroner to examine him more and give the final report for him and the death report also, so that it can so that you can proceed with your what do you need to do with your father after the coroner office.
Do you think, doctor, there is something criminal for his?
No, it's obvious for us that the cause of his death was this heart condition, and as I told you, all the imaging studies and all of the blood tests done for him has showed that he has this heart attack, and this heart attack also has led to the bad heart condition that led to unfortunately to your father's death. I'm really sorry for that, but this is like the known procedure or the known protocol that we have.
I don't want doctor to disfigure my father body. I don't want to do this, doctor, for him, this procedure.
So be assured that there will be no disfigurement that you will notice in the body. It will be only like a small incisions for doing more investigation over the body, just to make sure that everything was going as or everything was really as a result of what your father has developed. And then after that, the coroner will give you the death certificate so that you can go for the ceremony and the burial.
Okay,
That's okay
doctor.
with you, Mr. Rami?
When I will take my father body, doctor?
So it will be as soon as possible, Mr. Rami. Just be assured of that. We are going to proceed with the coroner office, and we are going to try to finish everything as early as possible. That's okay with you, Mr. Rami?
Okay, doctor, what to do, doctor? No other option, right?
I'm really sorry to say that, yes. We have to wait for the foreign office so that he can release the certificates for you, and be assured that we are here to help you if you need any more help regarding the preparation or any other needs you have. Just to mention it to us to see if he can help you regarding this issue that you have.
Okay, doctor. Just I want to process for the funeral, doctor.
All right. Okay. Sure. Can I ask you who was support for your father or anybody who needed was dependent on him?
Yeah, my mother, doctor.
I'm really sorry for that. Does she need help now? We can refer, or we can refer her. We can ask the social worker to help regarding your regarding if your mother need any help at home.
Better, doctor. Yes, I don't know how I will tell this news to my mother.
Yes. Okay. Sure. For that, I will inform my social worker to help your mother regarding the issue. Do you need any help, Mr. Rami? Do you need anybody to drive you home, or you need any
No, doctor. I will
support?
wait here until they finish.
Okay, Mr. Rami. Okay. Just if you need any if you we have also some like religious help here in our hospital. If you need any religious support, like if you need to meet with our we can refer you to our religious
Yeah.
department. Yes,
Yeah,
sure.
good idea, doctor. I need them to be beside me and my family, especially my mom when she come to the
Yes, sure.
hospital.
Yes, sure. Okay, so I will inform our religion department to help you regarding this to help you with everything you need, Mr. Rami. And I'm really sorry, and just our condolences regarding your father. And we will give you the hospital also number if you need any more help regarding your any more help or any social support or any psychological or any psychological support or any religious support that you need, Mr. Rami.
Thank you, doctor.
Thank you. Thank you so much.
Okay, time is up. Yeah, perfect, Dr. Sarah. I think you did it well. And you discover the hidden point here and in this scenario. Yes, I guess this scenario for Corona, because unexpected death, and in the same time death on the theater or after the theater, maybe minutes. It's not clear, and no clear data about the death when exactly after the procedure or during. However, if less than 24-hour unexpected, we have to raise this issue to know what happened there or why he had this cardiac arrest and so on. So you discover it and you explain it well. It's not optional thing. It's mandatory, and no one has option to sign any consent for that. It will be done by our coroner team, whatever the acceptance or no. And the concern for cuts, yes, it's cut, not incision. You said incision, Dr. So I'll take care of the jargon, okay? You said incision, small incision. So instead, you can say it's small cuts in his body. It will not be noticed by others, and it's important to know what's happened there. And the word I told you, I want you to say instead, as I said. Okay, try to do it.
Regarding the cuts, right?
No. The word I told you, as I told you. They
yes.
are saying yeah, it's not recommended to say as I told you.
Yes,
You can say instead as I said.
Yes. Okay. Yes.
Okay.
Okay.
Apart from this, yes, the support you offer well, and also the religious team is called spiritual team. This team concerned for the religious issue in the hospital, and they can come, as you said, they can support the patient, and they can, yes, so spiritual support services. They can help you in this issue. Spiritual team or special support services. Okay, they are concerned to such issue, the death and the family after any family member death. Apart from this, you did great, Dr. Sarah. Special support service, yes. Bereavement team, the bereavement services did another service for breaking bad news and sitting with the family after death formation. This is another also office or other service you can offer. Both
the what?
are,
Doctor?
yeah,
The what?
bereavement services.
Okay.
Okay. Knorr considered jargon. Need explain or not jargon. No, coroner is known. It's not a jargon. Coroner office known for any person. We are the one we don't know about this coroner, but in our Arabic language we know the طب شرعي. It's known. It's not jargon one. Even you can explain more about the coroner job and the coroner the task in this scenario, what they will do and why they want or why they will do the cuts for the father body. Okay, but it's not a jargon. Any other question or comments? You have any other comment, Dr. Sarah? Sorry, any other scenario you can do? You have other extra scenario?
No, I did not.
Okay, I
You
will
know
ask
the
Dr.
scenario of
Aisha.
cholesterol?
Yes, give me
Uh,
Dr. Aisha the scenario. You have
I
it?
think Dr. Ahmad did it. It came also in UK. This
Okay,
the patient have myopathy from our myocyte or
you have
muscle
it?
pain, yeah, from cholesterol lowering medication.
Lipid lowering
Statins.
therapy. Okay, if
Yeah.
you have this scenario, you can post, we can do it. Or you don't have.
Sorry, Dr. Ahmad is a mentor or what? I'm not sure.
As examiner.
He's an examiner.
Examiner. Yes, and he did this in the last session.
Okay. And he's giving mentoring. Yeah, he's giving
3 sessions, yes. He's giving 3 sessions.
My friend told me that the same scenario came in the
Really?
exam.
Yeah, I
And
think Dr.
they
Ahmad.
ask about injection. The patient just a surrogate يعني keep asking. I heard about new medication you can offer me is like better and
Ezetimibe, I think. This is ezetimibe.
yes injection yes monoclonal.
Yeah, biological
Not
ones.
ezetimibe. It is like is
the new
some
medication they're giving is for the cardiac patients specifically.
monoclonal, not cardiac specific, but it is new.
I mean other patients can be, but specifically for the cardiac patients, sometimes they will give.
Just I think they need us to know that there is new options in the treatment of cholesterol.
There is what?
New options for treatment of cholesterol.
Yes. It's I think to augment the function of oral therapy, of statin, I mean.
Yes, not. It's just replacement for statin.
No, I think it's add-on therapy.
No,
It's
no.
not replace.
No, it is. When I search about it is like lipid lowering medication monoclonal
Replacing.
injection every 2 weeks.
BCS K9 BCS K9.
Yes, I think this is the one. But if you are the one you mentioned, Dr. Khalid, this is the add-on therapy. Added to the atorvastatin or to statin. I think so.
Yeah, they are already giving it to a lot of cardiac patients. Some patients also with familial hypercholesterolemia, they are already starting giving this one for some years now, for some time now.
Mm-hmm.
Yes, they're giving, but I cannot remember the name now, unfortunately. But they're giving it. They're prescribing it for some cardiac patients, specifically with severe hypercholesterolemia.
Anyone had
The
this
scenario
scenario?
was this is I remember from Dr. Ahmed. The patient has muscle pain, and although he taking 80 milligram from the statin, he still has high cholesterol, and he said he's not compliant because he has muscle pain.
Mhm.
والهيستوري بقى ان هو كان عنده قبل كده MI وكده، فانت ضروري عايزه يبقى
Yes.
compliant وعايزه ياخد
Yes.
ال 80 طبعا رقم كبير، في نفس الوقت مش still
مش
the
not
cholesterol high.
effective. Yes.
فهو السيناريو كان كده. هي اللي زودته بقى يعني زميلتي اللي قالت لي، ان هي قالت ان هو البيشنت keep asking there is injection I heard about it and
Okay. And the
I
injection
need
was written in the scenario
no
at all.
at all.
Okay. Then
She said طبعا lipophilic و hydrophilic there is another medication that
yeah,
can have no side effect.
rosuvastatin. Yeah.
Yes.
Rosuvastatin. Yes.
But the patient,
Rosuvastatin and bravastatin also.
Yeah.
yes,
This is
but
the head.
the problem is the surrogate asking I need other things.
Okay. I guess Dr. Aisha, if not written the other options.
Just you need not to tell her
Yeah.
no.
Exactly.
No injection. Just you have the information. I think they just
And always
checking
keep.
if you have updated with the new.
Yes. And you have to mention that what's written for you is the best interest for your condition.
Yes, but also we have this option. And I search it, yes, it is option. And
Yes,
they can be
it's
option.
option. So why not written from the start? This is the problem. If the
Yes, because
consultant.
it is like any monoclonal has more side effect, I think. And also for
So
it is very expensive.
so
And
how
it
to
is very
explain this to the
and it's
surrogate?
injection. We will not explain. I think we will enter in dilemma if we enter this way. Just you
So
will admit that there is option, but we will try to this alternative medication, and I'll arrange another meeting with consultant to
yes,
hear
good,
from you,
yes.
to hear
Good
from
also.
you,
Yes.
and he can we can just try again by this medication, and you can tolerate it. And after that, we can think other options because it is best for you. And the other option may have also bad effects. Any medication has bad and benefit. But just admit there is injection because if you make conflict with the patient, nothing like that, you scenario will be bad.
Yeah. I guess if you are not aware about these options, as you said, you can refer her to the meeting with consultant. He will sit with you and he will address this issue with you. Meanwhile, this medication prescribed for you was the best interest for your condition. And to be prescribed no medication, such you are mentioning, you have to sit with the consultant
And
and
admit this as a side effect because if you, Dr. Ahmed also said like that, admit it as
yes, of
yes,
course, this is
your
one of the
muscle pain
possible.
from this.
Exactly.
Yes.
This is one of the side effects known for
Because
this
also
medication.
he said in this, someone he cannot admit, he will say the patient the medication is okay or something like that.
No. If you deny, you will lose the case, of course.
The
This
injection
is
name is Rebata. Rebata, this is I remember now. This is injection given, I think I'm not sure, once weekly, something like that. And it's covered
Every 2
by
weeks.
insurance. It's covered by insurance in the Gulf, actually. So, yeah, it's available for some years now. And they're giving it especially in the severe hypercholesterolemia not responding to, or familial not responding to the oral medication, especially if the patient has complications like ischemic heart disease.
what's the medication name? Is it Imab or is it wrong? Is it Imab? I
But I
think.
remember, I don't know, I remember the Repatha. This is the brand name. I'm
Yeah,
not
is
sure.
it Imab? I found now in Google. Is it Imab?
Evucolumab, monoclonal. This
Yeah,
is
but
the same
it's very,
Rebasa, yeah.
but it's very effective in lowering cholesterol levels.
Yes. Just the patient, if she said to you, what if the other medicine not work also or have
But
some
what
problem with me,
yes,
just you will tell, we will see the other options.
yes. But what I know,
Mm.
Dr. Aisha, they are always starting with the statin. If the effect is not
Yes,
the one
it's
desired,
first line. Yeah.
yes, then you can add on, but not from the start. This is what I know from sorry, from part 2. We are starting
Yes,
with
yes.
statin, waiting to reduce the non-HDL to 40% from the baseline. If not, we will consider adding another medication.
يعني
So
هو
statin-
this patient he has statin myopathy or he's afraid from statin myopathy.
He had
He
already.
had, yes, had.
Oh.
And still high
و-
cholesterol, and he is not compliant about high dose. He taking 80 statin per day.
So they can give like fenofibrate.
No, fenofibrate not for cholesterol, not for
Fenofibrate for another.
triglycerides.
Triglycerides mainly, yeah.
It is
Rosuvastatin.
Ivoclomab. This monoclonal antibodies injection, subcutaneous injection every 2 weeks. It is like inhibitor of some enzyme in LDL mechanism, but I think we don't need to know all the, just because in this scenario, just the information will be like new to the, if you don't know the information, you just will tell her no injection or something like that.
No, if you don't know, tell her, I will update you. I will ask my senior. This is
Yes,
general
like that.
advice. Is no one saying no or clear answer for nothing not sure about. He will be in trouble.
Mhm.
But he should
But
continue.
if she ask you, I can't take this injection, we will arrange another meeting.
Dr. Yusra, the one asking, right? He should continue.
Yes.
I think.
No, we will
No.
replace.
Yeah. Yes.
Replace by
Even rising
hydrophilic.
liver function test. Yeah. Rising liver function test after starting lipid
3
lowering
doubles.
therapy. Yeah, this is also another indication to switch or to change.
Yes.
I
Switch
think
to what?
is it covered also by insurance there or not in the UK or not? In the Ribath, I'm not sure. It's covered in the Gulf, but I'm not sure. I think it's better to say we will have another meeting because if also
Yes,
we are not
exactly.
sure.
Yes,
It's
like
covered.
that. It will always be like that. You will try the
This answer.
hydrophilic. Yes, and in the meeting, the hydrophilic. If she raise the issue of injection, you will tell her there is a lot of options for treatment, and we make step by step. All medication
Exactly.
has bad effect and good effect, and we give you the best for your condition.
Exactly.
What if not working, doctor? What if he has also, because this information also, the hydrophilic has also myopathy pain, or يعني has some percent, but less than the lipophilic statin, but has some percent also of muscle pain also. What if not
Yes.
working? It's not to say no, it will not cause to you muscle pain, you will be okay or like that. Any promises in medicine. Just will sit. We will be with you. We will follow up you regularly. If you have any problem, just contact us. We will arrange another meeting. We will try another medicine. We have another options. Just set another options. This is the word they need to hear from this scenario, as I hear from Dr. Just said there is another options.
Yes. And also, as general advice, it's not, I mean, the communication, the good thing in communication scenario, it's not yes or no.
No
I mean,
information.
yeah.
They need from you to be diplomatic, to be communicating.
Exactly.
Like
Don't
that.
be sharp in answer. Don't be disappointing for the surrogate. Don't be aggressive. Just try to keep the dignity and the respect for the surrogate as long as you are talking with him. For the information and knowledge wise, if you are not sure, don't promise. Don't give also sharp answer and refer to the consultant meeting. Be diplomatic always with the things you are not sure about.
Yes.
And always give the follow up and the care. We are here, we will follow up you. Don't worry. If long term disease, we will be with you in this journey. You will not be alone. All these things give the examiner the sense that you are expert in convincing the patient. This is what they want, not the clinical judgment only. But for clinical judgment, for simple information, you have to know. So there is point you have to give answer, and there is also other points. It's gray for others and for you. Don't give clear answer. Be diplomatic and refer to a meeting. Okay. So the point of myopathy with the statin, it's clear. Yes, it happened, right? So you didn't tell. I will ask my senior. So for what you will ask your senior? It's known information. All of us know about this. Myopathy is a side effect of statin or lipid lowering therapy. So the good thing here, yes, be diplomatic in the thing you don't know or you are not sure about. And in the other way, don't be disappointing. Don't tell her like, no, I will not give you. And don't be also aggressive. These advices I think we got from the practice, day after day. Okay. Dr.
Yes.
Muhammad wrote here also, rosustatin, yes, less muscle pain compared to atorvastatin, exactly. Inclisiran, the name of injectable form. Dr. Sarah wrote inclisiran. This is, I think, the brand name. I share also ezetimibe. This is what I know. Ezetimibe. This ezetimibe work by inhibiting absorption of cholesterol in the intestine. Reduction of cholesterol absorption leads to low
But it's
cholesterol.
not effective when patient has before heart attack, MI. Yeah. It is not alone. It is only
Yes,
combined.
this add on.
Always
Yes,
combined. Yes.
this add on. Yes, add on.
Yeah.
Okay, Dr. Aisha.
There
Any
is
other?
also omega, I think fish oil, omega, I'm not sure also.
What?
The omega, the fish oil. Sometimes
Omega also is add-on.
add-on, yes.
Add-on.
Yeah, but we cannot use this alone. Yes.
Yes.
Mhm.
Not, the injection, I think, alone, because I trying to read about it. It is ribasa ivoclumab. Every 2 weeks.
I just read today about aviculumab with HUS, hemolytic uremic syndrome.
A lot of we will not keep these names. Just it's monoclonal.
Yeah, I will not give a clear name. Biological therapy.
Yes. Just to know that it also has side effect. It also be line, but to be line and to have side effect. Just this information they need from us, I think.
Mhm.
The other scenario she has in communication, a patient has a stroke and has visual problem from stroke, and she discuss with you after on discharge about driving. And all the scenario, the patient need to drive, and only I'll drive 5 minutes my children to school. I have no one to like that. I'll not drive, but I'll not inform the DVLA, and all the scenario like that.
Okay, if 5 minutes only, okay, no problem. She can drive her kids only.
Are you sure?
No, of course. But
No,
it's not,
yes.
not an excuse. But what I
But
know, if a stroke affecting driving, sorry, affecting vision for 1 month, and then she will be reassessed again by the neurologist. And if not, she has to inform DVLA. I mean, after 1 month, if still the vision.
from start, she should inform.
Okay. I remember Dr. Ramad mentioned this scenario before. One month after stroke, any affection happened to the vision or any ability affected to
I
drive?
think it will depend about Dr. Best. In TIA, it is 1
No, it was
month.
stroke. He said stroke.
Because it will depend if stroke and no reversible for the condition.
Of course,
What you will do.
what I said, Dr. Aisha, I said even after the month,
recovery.
reassess. Yes, she will be reassessed again. Because maybe the vision is still impaired, so she will drive? No, of course. But if after 1 month the vision is okay and she can see well, the acuity, the fields, everything okay, why not? Isn't? But if she argue with you and negotiate with you, I will not inform. This is another issue. You have especially if she is banned from driving. Sorry, I'm afraid to say, if you are not informing them, I'm sorry to breach this confidentiality.
You don't say that, Dr. Bas.
Really?
Leave this is at the end.
At the
Yes,
end, of
I just
course.
said,
No.
and don't say,
After,
and in my case, I will not say this. I will not conflict with the patient. Just I'll arrange another meeting like
What?
that. Be diplomatic.
What if she said, I will drive, doctor? I will not inform.
Yes, if
No.
said like that, but
Yes, you said that,
always the
Dr. Aisha.
patient, the patient will say like, I'll tell you the scenario exactly how it. She will said, why you prevent from driving? Because you have
Okay.
some.
Yes. Okay.
Okay, how much? We don't know. We will assess you, but just informatively. What if
Okay.
I drive? I am sorry to tell you, this is the insurance will not cover you, and you may have your life and the other to be in danger.
Okay.
Okay, what is if it is 5 minutes like that? It to the school and it is side street like that. I'm sorry to tell you that is also you should not drive at all, because we don't know that any situation can happen, and offer a solution for this problem, because you should help him. Okay, anyone can drive him. Then they can go walking. Any bus you can, if you have
Yes,
social
exactly.
support,
Yes.
if you have financial struggle, we can help like
Yes.
that. If he said, okay, doctor, I'm not drive, but why I should inform the DVLA? You should inform the VLA, because they will assess the ability of you, and they will give you the time you should stop driving. But I'm not sure, doctor. What if I not inform the DVLA? You will advise again, just advise. This is will be you will be at risk if you have anything. If anything happens, you will not able to have insurance compensation or anything, and this will also make you on legal have يعني انت هتبقى متعرض لمسألة
Yes,
قانونية
yes.
أو حاجة زي كده.
Okay.
Okay, doctor, I'll think. But I really bothered about that. Okay, we can arrange another meeting. We can bring other one from family to discuss the issue together again. We can like that.
Okay. But the point when
But
she
the point we will
insists,
breach, yes, if we will not
yes,
inform,
if
we
she
will not.
insists for the third time, for example, and you feel from your feeling
But don't
that
let the patient reach to you a
yes,
point
exactly.
like that.
No,
To say,
I
no,
will
doctor,
not.
I am not informed.
Yes. I agree. Yes, 100% agree. Because if you reach to the negotiation, you might lose your control, and the words will be against you. So what you will do? Try to convince her, please, for your safety, for other safety, for your kids. You are precious to your kids. We don't want you to be in harm and others. But in case, because sometimes the time will allow you to reach to the level of, no, doctor, I don't care, I will not inform, and I will go drive.
If you tell all this, you will not find the time to say to you like that. So we will end by diplomatic. إن شاء الله
Yes.
يعني ربنا يستر.
Yeah, you're right. Yes. I think, yes. Okay, Dr. Aisha, if you have another scenario, we can discuss.
She said to me the other stations, they have to communication about stroke after stroke rehabilitation.
Yeah,
We
the
should
same
know.
you did. Yeah.
Yes, we should know how the patient will deal and what medication will tell the exact dose for every medication and what time he will take. They will give in scenario some medication, and you will give the patient the side effect common in each medication, and tell the patient how to take this medication. This is all the scenario communication. This patient is discharged today from stroke, and he has this list. Sit with the patient and discuss with him the medication and the lifestyle after. Just that. You will talk
Okay.
about
And
smoking,
what are the
about diet,
medication?
regular, and don't do strength exercise. Just have fine exercise. Don't stay at the bed. The diet will be healthy, like that. Stop smoking.
Yes,
And the
all
medication,
this. Yes, the
you will
medication, the
talk
problem in medication.
antiplatelet, the most important one to take about the side effect and how he will take. And the other also medication, the antihypertensive medication he add for him, I think lisinopril, and you will talk if you have any cough. If it is bothering you, really, you can follow us again, and you can also there is a
Switch.
statin, and you will also talk about statin. It can cause some pain, and we need to check your blood after 1 month from starting this medication. So you have one follow-up appointment after that. You will have also appointments with physiotherapy, and you will say like
By the way, atorvastatin
rehabilitation.
taken evening time.
Yes, at bed. And aspirin or carbidoral maybe after diet.
Mhm.
You will said,
Yes.
and lisinopril at morning.
Mhm.
Just this is a scenario, and you just need to write the notes before starting the scenario, because it will be
Yes.
too long,
Yes.
and
Yes.
you will miss important points
Yes, exactly.
like driving, like
Yes.
exercise and diet, and this smoking very important.
Yeah.
So you will write points and try to finish the point as much as you can.
Yes.
لكن
And
هنتكلم على كل drug side effect
the common
just
thing.
a point or 2
The common,
points.
the common side
Not
effect.
but the thing is they keep I think commenting that from the other diets, it is from bleeding of antiplatelet.
yes.
To take on full stomach, and if you have any black stool, if you have dizziness, if you have, and also you should awareness the patient about symptoms if he has other stroke, like
Mhm.
if you have any
برضه بوست ام اي وديشارجد على فور
yes,
دراجز
the same, yes, the same yes,
yes
it is also coming in other diets. Yes, they like these scenarios these days also.
بس لونج سيناريو لان انت اللايف ستايل هم قالوا كده ان اهم حاجه اللايف ستايل موديفيكيشن
Yes,
والاكسرسايز
it is long story, so it is a very important point to write like points that you should not miss. After that, you will miss some things, but the important point they will comment on, just don't miss it.
Anyway, the lifestyle contains 3 points: the diet, exercise, and a good sleep.
And the smoking and
The smoking and alcohol is another
driving.
separate. Yeah, but a lifestyle, yeah, the diet, healthy diet, and the what I mentioned, diet and exercise. Yeah, you have to do not heavy exercise, even simple walking 30 minutes per day for 5
Yes.
days in the week.
Yes, like that. Exactly.
Yes. Yeah, not in details more than this.
they told even for intimate relationship post MI you have to kill him.
Yes, they said this point also you should mention.
Okay. This is specific for MI. Yes, for 1 month, I guess,
For
right?
MI, yes, for
Yes,
MI.
for 1 month. Yes, and driving, smoking, alcohol, job. This is another also point.
Yes, the job, I think they said only 1 week away for a
1
stroke.
week, according to the report or the assessment. I don't know how many days. Also, the hobby, if
Because
there is
there is concern with the patient. What time I can go back to work?
okay, let's say a diplomatic answer again. We will reassess you again, and we'll tell you when you are ready to go back. That's it. Don't give frame time
My friend
specific.
said that she said like, and
Okay.
this what she know from courses, that if you feel okay and you can tolerate your daily activity,
Yes.
you can come back to work. Yes. She said like that.
Okay.
لان دي بتختلف ما هي برضه
Exactly. Yes. Yes,
حسب
exactly.
الجوب ممكن نسأله برضه what is your job, what you do.
الاوفيس جوب هتبقى غير
But even Dr. Aisha, don't give time, specific time.
Yes, okay.
Yeah, maybe it's wrong. Maybe it's 10 days, not 7 days. Maybe week, not 2 week, whatever. So
We can say just stay at
yes.
and take your time, and
We will
how do you
reassess
feel? Why do you daily activity? And
and reassess you
yes, we
whenever
will
you are
assess.
okay.
Yes,
Yes, you can go back to your work.
yes.
Okay, what other scenario?
I don't know. This is all I remember.
You said two communication. This is one.
This
The
one,
second?
the other.
The other for the myopathy?
Yes, the other myopsy, and there is a stroke with eye driving. This issue, but there is one other one for the other because we are 2 days exam, but I don't know the other.
No problem. Whenever you remember, you can post it to the group. The good thing in the communication and long, there is 5 minutes before both scenario. So to get ready, to write your scheme, to write your special points, driving, and if you suspect HIV, you can write the HIV risk. If you suspect something related to the intimate relationship, for example, like Dr. Yusra mentioned, you can write it, because whenever you start talk, you will never remember what you plan to talk unless you wrote in the paper. So write in the paper, try to look at the paper while talking. I finished this point, so you can mark yes or on it or write. Another point,
Not to look at the patient and look frequently to the paper.
but
Not,
better than forgetting, I think.
It will be like every, يعني if you miss
Yes.
or may make recap like, but if you write it, you will remember because
والله
you just
Okay,
اللي
you can
نقدر عليه بقى.
you can act like I will draw for you and just write draw and catch the words from the paper.
Mm.
I think it's okay to look at the paper. The problem with
And
the
I saw in a video of past test they looking. It's normal.
Yes.
Not you will not
Mm.
look direct to the patient all the time.
Yeah.
It's not also practically. And you will look here and here. No problem.
Exactly.
the problem is looking at the watch, but looking at the paper, it's okay.
Yeah, the watch is the problem. Yeah.
Really? It's not allowed?
Not allowed, but it's like making you
No,
like
it's not allowed. It's not allowed. It's not allowed.
hesitated.
You can look just like you are a glance.
Counting the pulse.
There is a clock in the setting.
The communication is not allowed whatsoever. I think in short scenarios, it's not. You are not allowed to wear. You are not allowed to wear a watch. In the long cases, I think
You're not allowed to wear a watch in all the stations, but you can put it in your
Belt. Yes. In the
yes,
belt, you can put in the belt.
or in female they put like in blouse.
Yes. And
But
that's
I think in the long case, you're allowed, but you're not allowed to look at it frequently. Only for the pulse, for the thing. I'm not sure, but yeah.
There is one also one on the wall in front of
Are
you,
you
but
sure?
also don't look to it. There is a wall clock, but you will not also look for it because also they like make bad
So
impression for
the only time, the only accepted situation to look at the clock when I
the pulse.
count the pulse. That's it.
Our respiratory. Yes. It is give a bad impression from you and irritate the candidate, irritate the surrogate. Sorry.
So I will just drive the scenario blindly, and
Yes.
I will wait for 2 minutes left.
And
Actually,
even
After
you
that,
put
Dr. Bassem don't
examiner.
make the timer on the screen because we are used to see how much we have time.
I'm not sure, wallah. So you want me to do practice without looking at the time?
Yes, remove the timer from the screen. So you will be routinely making yourself timer, your mind by
Yes,
time.
yes.
Yeah.
And whatever you are doing, try to be fast, because in this way you might lose the time, the sensation of the time.
But if you make this many minutes, you will you will catch that you are late or you have time.
I feel I will feel I am late when I hear only 2 minutes left. I'll be trouble in this moment on.
If you catch the case, you can examine, and after that you can complete. Because if you have time, okay, you will complete. If no time,
Yeah.
you already
Yes, you're
did
right. Well, yes, you're
the
right.
important point.
Yes, you're right. Whenever I catch and I'm done, I can start examination. Then in between, I can ask about the other symptoms, system review, waiting for the 2 minutes left.
For
Yes.
consent.
Oh my God. Okay.
The
Thank you,
problem
doctor.
with examination of the consultation case was chest pain, and the surrogate was wearing, or the patient yani, because he is the patient, wearing clothes. So you
Yes,
will ask to remove the clothes
yes, of course, I
because
will ask him.
she found sternotomy scar. So you will like just you don't be like put the stethoscope in
No,
above of
at
clothes like
all,
that.
at all, never, never.
Even it will take time from your time.
No problem.
I
I
don't
will
know
wait
why
for
they
him.
did like that, because
Yes,
it's very
yes,
it was time consuming, and in consultation you have very little time.
no problem. My colleague said to me like the same. And the one, the surrogate was wearing button from the side, so it's difficult for him
Other
to remove.
also for lower limb edema,
Yeah,
they wearing the socks, the shoes and socks.
no problem. Ask him to
You
remove.
will
Ask
remove.
him.
Yes, it is very time consuming and
No
very irritating
problem.
to you.
No problem.
Before they not doing like that.
Yeah,
Before
they
they
are.
not doing
I
like
think
that.
intentionally they are testing your anger control. Are you stress
Yes.
control or
Before
no?
there is bed, you can let the patient and you can examine good. But with sitting and the
Just
patient wearing socks, the patient will remove the socks and the shoes, and you will wait.
just
Very.
calm down. When you start examination, you will introduce yourself, and if you notice that sucks, please ask him immediately. Can you remove this and this?
And there is edema. After removing the socks, you will feel the edema.
Yes,
So
that's
they try to hide the finding.
yes, of course.
It's
So why you
very.
are why you are going to exam? They will show you everything. They will hide these
But
things.
why? You will check. So let this simple. Just the patient will not like
No,
sliver,
they are
very sliver.
they
Why
are
shoes and socks?
yeah, they are testing how much you are controlling your stress, and in the same time doing examination, and in the same time answering the concern and the question for examiner. This is the exam. This is the nature
Yes.
of exam.
But it is
How
good to know before the exam, because yes,
yes,
you are
yes.
predict
Don't
that,
be
so you will not
yes,
be
don't
like in
surprise. Yes, don't be
stress.
surprised.
Yes, no stress. More,
But
yeah.
whenever you go in and the exam is to chest exam, the task is to examine the chest, ask him immediately, please, I'm Dr. X, I'm coming to examine you, please. Can you unwear your t-shirt? Okay, doctor, you are Mr. X, and start examination. If he talk long, you can help him. Because I hear also they are taking long while unbuttoning the t-shirt.
Yes.
Slowly. This
Mm.
one will irritate you more. Try to examine the legs first if he take long for removing. Start by examining the leg for leg edema, for clubbing or whatever.
The hand. Try
The hand he's
examine.
using for unbuttoning, how I'll examine his hand.
There's a problem.
And the opposite, you can do the opposite. If you are examining the legs and he's wearing socks, you can start by, but how also he will use the hand to remove the socks. May Allah help us, inshallah.
Inshallah.
Okay, thank you, Dr. Aisha, for the advices and the experience you shared with us.
Thank you. It's really.
It really relieve some stress, some, not all. But
Inshallah,
also,
you will do good.
inshallah, hopefully, inshallah, I mean, all of us, inshallah. Okay, any other point to be discussed? Anyone has any idea to be discussed? Open discussion. Okay, thank you, Dr. Sarah and Dr. Aisha and Dr. Adil and all comments and help. See you after tomorrow. Have a nice weekend. Good luck. Inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام.